This is Changemakers with Katie Gore, finding the right solutions for the affordable housing community.
This week's Changemaker is Sarah Kahn, President and CEO of Housing Forward. She leads the fight against homelessness in Dallas and Collin counties through data-driven strategies and strong public-private partnerships. With over 20 years of domestic and international experience in homeless services, Sarah is a passionate advocate for sustainable solutions. Sarah, welcome to the podcast.
Thanks for having me. I'm excited to be here.
It's an honor to have you. And with such a conversation, I am eager to hear the solutions and what you guys are doing. Before we start, though, I would like to hear how your journey into this work first started. What inspired you to pursue this career, or just start us off from scratch?
Sure. I think my journey is unique in many ways that I've sort of always known that I've wanted to work on homelessness, even at an early age. And throughout high school, I wanted to volunteer in this space and really felt like I had a calling to work in this area. I knew from an early age the kind of built-in advantages that I had and my family had from growing up in a white middle-class household. And so, I think there are several ways, right, that white middle-class households really are offered privileges that other households, particularly Black households and households of color, were not afforded, right? Even thinking back to when my grandparents were purchasing their first home, that was a time where the federal government was actually providing subsidies, handing money to white families to purchase homes in higher opportunity neighborhoods. And that was the same period where Black families were systematically denied access to those neighborhoods and largely shut out of the home mortgage market. And at a young age, I started learning about these things and really felt like because of the privileges that I was afforded that others weren't, it came with a kind of great responsibility to use that power to address inequities. Because the result of being able to sort of accumulate wealth over generations in households means that there's more cushion to fall back on when a crisis happens. And that opportunity was not provided to all households. And there are huge inequities in that I always felt sort of a calling to respond to.
It's an interesting recognition and awareness on your part, but then you've done something more than just that. You're actually trying to create solutions. It makes me think, like, what would you tell younger professionals or maybe social workers or just community activists who may be considering next steps? Is there something that you would say about how they can make a difference with homelessness and even equity related to communities?
Yeah, for someone first starting out in their career, I think the most important thing in whatever social justice issue you're going to tackle is that you're very committed and passionate, because the environment in which we all work is super challenging. It's super complex. And at the end of the day, what I learned from my team and those around me is that it is that mission-driven nature that keeps all of us going through those hard times. And the hard work becomes joy for us because we are working towards something that feels very important, that we're all very committed to. And so I think the first and foremost, I would say follow your heart and do the work that you care about most, because that will get you through the really tough times, whether that's the complexities that we face related to having to fund the work that we're doing, or the political pressure around this issue right now. There's a lot that we're faced with as leaders in this space. And so it's important that we're very passionate and driven by the issue in order to keep going and to thrive in that setting.
That's a good reminder to all of us, no matter how long we've been in the industry. So let's talk about some of that work. You're in Dallas and Collin counties. And what exactly are you doing? What are you seeing to combat homelessness? Just start us off and share some of that.
Yeah, I am the CEO for Housing Forward, and we are the lead agency for the homeless response system for Dallas and Collin County. which means that we are really the quarterback of the sector. So we support the sector by providing backbone support, whether that's through fundraising or through helping to design and implement effective strategies, doing training and capacity building, anything. We listen kind of deeply to the needs of our providers and try to show up to streamline pathways back into housing for the people that our provider network is working with. And we have had tremendous progress in the last few years, really because of the incredible service providers and public and private stakeholders in this community that have all joined forces and have acknowledged that we can have a bigger impact if we're all working together under a unified strategy. And so in 2021, when I started working with Housing Forward, that was the year that kicked off this new way of doing business. We had incredible service provider partners at the table who were very, I think, hungry for a lead agency that could work on behalf of the sector to bring people together around a shared vision. And part of that was having all of those partners also coming to the table to say, let's coordinate around a unified way of delivering homeless response in our community. And by doing that, that set us up to really be able to align them public and private dollars to the same types of housing focused interventions in our community that were proven to work. And by all working in alignment, we have had a huge, a quite substantial reduction in overall homelessness in Dallas and Collin County since 2021. And in particular, in unsheltered homelessness, we've seen a 24% reduction, which is where we've had a large focus because of just the amount that unsheltered homelessness had grown prior to that period. So we've seen a 24% reduction in unsheltered homelessness. And this is during a time period when national rates of homelessness have actually soared to record highs. So last year was the highest increase in homelessness on record in this country. And so I think all of that just really signals that the shifts that we've made as a community and the strategic moves to transform how we do business together are paying off. And paying off in a big way in terms of starting to move in the right direction.
What kind of numbers are we talking about that Dallas and Collin County are currently experiencing as far as volume?
Yeah, so typically we measure trends in homelessness by looking at point-in-time data annually. And so on any given day, there are about 37 individuals and people and families who are experiencing homelessness. And a little over 1,000 of those are people who have no shelter at all. And so those are folks that you might see on the sidewalk or in a tent under a bridge, or behind a building. And so we have responses for both unsheltered and sheltered homelessness.
And what are the most successful strategies that communities can do? A lot of people are doing a variety of things, some not as successfully as you are pointing out here with this 24% reduction. But if you were going to guide somebody who says, we're overwhelmed, we don't know where to start, how would you guide them?
Yeah, well, for communities, I think that are just kind of embarking on looking at how they might do something different, there are some structural elements to our success, and then there's just the actual strategies that we're implementing on the ground. I think the structural components are things that I just talked about. Like it's critically important that we are bringing our collective strengths together to have the biggest impact, which means having shared goals, deciding on a standard way to deliver pathways back into housing for people on the ground, and then really building the trust of both the public and private sector to bring their dollars to those interventions so that we can scale quickly the types of resources that we need on the ground. Because just like we don't want each provider kind of delivering their own type of service, we also don't want funders each delivering and funding a different type of intervention, because then we can't actually make progress together. And so structurally, I think those are the key ingredients. In terms of the interventions that we have found to be most successful, We have the paradigm shift, I think, in our sector over the last 20 years has been moving towards housing-based solutions. And it's not always intuitive. For years and years, as a homeless response sector, we thought that there were individual factors that really led to homelessness, and that those individual factors that someone might be facing needed to be fixed before they could be successful in housing. And what we've learned is that moving someone and fast tracking someone into their own permanent home and then helping people rebuild their lives is the thing that gets us the best results, and allows us to keep up pace with the number of people who are coming into homelessness each month or each year. And so we've learned that the best remedy for homelessness is a home. And when we listen deeply to what people experiencing homelessness tell us they need, people tell us they want a home, right? And once people are in home, then that's the foundation from which we see people and support people to connect back with employment, or to connect with healthcare, or to connect with family and friends. And those things are not unique to someone who's, recovering from homelessness. So those are the things that we all need to live a good life. And so the strategies that we've put in place are really about meeting people where they're at, bringing our resources to support someone where they're at, whether that's on the sidewalk, living in an encampment, but meeting people where they're at and supporting them through the steps that are required to connect back into healthcare, behavioral healthcare, but also to move directly back into their own apartments as quickly as possible. And then having that wraparound support follow them into the community so that people can stabilize.
You're really describing how the homeless services landscape has evolved over time. And I think it's important to highlight, you said the best remedy for homelessness is a home. And how does your community then embrace what you're doing? The greater community, beyond just the practitioners and the public and private partnerships, what are you saying to your community? Or is your community telling you to actively and more aggressively get involved? What are the dynamics there?
Yeah, that's a great question, because I don't think that where I sit, I'm unique in kind of what we are hearing and feeling from the community and from business owners and policymakers in the community. I think ultimately, while we are a city who has made progress, and that is unique in this moment, that our numbers are moving in the right direction, because of the strategic investments that we've made. While we are moving in the right direction, people are not always feeling that progress, right? If you're someone who sees someone who's very vulnerable, who's being left behind on the street, in crisis, or forced to sleep in a tent or on a sidewalk, when you are visibly seeing that, you're not really in that moment feeling the progress, right? And that's really important, because I think what it demonstrates is that we have a lot of work to do. And to meet this moment, and because we understand that we have a lot of work to do as a community, we have set our sights to reducing unsheltered homelessness by 50%. We've gotten to 24%. We want to get to 50% by January of 2026. And to do that, we know that we need to keep housing people, but we also need to address the need for targeting people in public spaces who are vulnerable, who have been left behind from our rehousing efforts, and to make sure that we have a concerted effort to house people in those public spaces. And that is really addressing, obviously, the concerns around public health and safety from the community's perspective. But we know it's also addressing our mission of ensuring that no one has to sleep outside in our community.
It's a tough dynamic, because as soon as you're helping people find permanent housing, you're also having new people enter, because the rate by which homeless people are experiencing homelessness for the first time is also going up. So this number reduction is often skewed a little because you have more people coming in. What is the dynamic that you're seeing with people experiencing homelessness for the first time?
Yeah, that's another great question. And the way that we've responded to that, like I'm just so impressed with this community and our ability to problem solve and rally around things like increases in first-time homelessness. The way that we deal with that and the reason that we've been able to continue making progress is we have implemented an intervention that specifically targets that group. And we call that diversion and housing problem solving. So this is an intervention that was pioneered in our family response system. We have now rolled that out and replicated that across all of our emergency shelters. And what that means is as people have newly become homeless, we now have our most skilled practitioners at the front door of shelters to immediately start helping someone resolve their housing crisis. And that means having very creative problem-solving conversations to figure out if families or individuals could go back to their previous housing situation, or could we support them to move into a cousin's house or with an aunt, or do we need to help them quickly relocate into another house of their own? And we have a little bit of flexible financial assistance that's available for households as well. But what we've learned is that first few nights is very crucial in ensuring that someone does not become entrenched in our system and entrenched in our shelters. And so we want to get people out as quickly as possible. Not only is that best for the individual or family to help them avoid the trauma of a long stay in homelessness, but it's also the cheapest intervention that we can provide. And we have had great success with that in the family's response system. And this year, by rolling that out across our emergency shelters for individuals as well, that is how a community like Dallas, who is a high-performing community in implementing kind of leading practice, that's how we've responded to this in a way that helps avoid those spikes in homelessness that we would see if we didn't have that type of response in place.
All right, Sarah, we have to stop here for now, but I definitely want to dive into some success stories from your Street to Home initiative in part 2 of our conversation. Coming up next time, Sarah Kahn, President and CEO of Housing Forward, will also share an important message for policymakers.
We can address the calls from our community to meet public health and safety concerns and also provide a compassionate response to homelessness.
Thanks for listening to Changemakers with Katie Gore. To find out more about Katie, go to quadel.com. That's QUADEL.com. This has been a production of Forbes Books Radio.